Your Excellency, Dame Margaret Binling, Governor-General of the Commonwealth of the Bahamas, Dr. the Honorable Hubert A. Minnis, MP, Prime Minister of the Commonwealth of the Bahamas, the Honorable Darren Henfield, Minister of Foreign Affairs, Dr. the Honorable Duane Sands, MP, Minister of Health, the Honorable Romuald Ferreira, Minister of the Environment and Housing, former Prime Ministers Ingram and Christie, Most Reverend Drexel Gomez, former Archbishop of the Province of the West Indies, Dr. Carissa Etienne, Director of the Pan American Health Organization and the World Health Organization's Regional Director for the Americas, members of the Diplomatic Corps, heads of international organizations, including Dr. Esther de Gouville, the PAHO WHO Country Representative for the Bahamas and the Turks and Caicos Islands, Dr. Sir George Allain, Director Emeritus of the Pan American Health Organization, permanent secretaries in the Ministry of Health and Ministry of the Environment, our esteemed PAHO Public Health Hero of the Americas awardee, Dr. Merceline Dahl-Regis, fellow PAHO colleagues in the room and around the region, distinguished ladies and gentlemen. Good evening. My name is Paul de la Croix-Vaubois, staff member of the Pan American Health Organization, and I will be your master of ceremony during this special evening here at the Government House in the Bahamas. I invite you to take a seat, please. We would like to give a very warm welcome to everyone attending this event, where we will be presenting PAHO's highest honor, the Public Health Hero of the Americas, to a very special lady who is here with us tonight, Dr. Merceline Dahl-Regis. We would like to give a special welcome to the Honorable Prime Minister of the Commonwealth of the Bahamas, Dr. Hubert Minnis, to the Honorable Minister of Health, Duane Sands, and to all the Bahamian authorities and friends who have joined us for this special ceremony. Before beginning this ceremony, I would like to invite you all to rise for the national anthem. I apologize. We've had the national anthem. I'm going to ask you, please take a seat. I would like to invite the Most Reverend Drexel Gomez, former Archbishop of the Province of the West Indies and Assistant Bishop of the Diocese of the Bahamas and the Turks and Caicos, to lead our invocation.
Let us pray in the name of God, Father, Son, and Holy Spirit. Amen. Gracious and holy God, you are the sovereign Lord of all creation, King of kings and Lord of lords. You are the source of all that is good, wonderful, and holy. We thank you for all you have given to us in this Commonwealth of the Bahamas, and we give thanks for the many agencies that have assisted us in our growth and development over the years. And in this regard, we give special thanks for PAHO and the many ways in which that outreach has benefited the peoples of this region, but especially the peoples of the Commonwealth of the Bahamas. And as we give thanks for their continued assistance as we seek to develop our outreach in the medical field, we pray that by your grace and guidance, we may be able to offer universal health coverage to all citizens and residents of the Bahamas. We pray for the ongoing work, all those involved in the direction of our outreach in the field of medicine and health care, especially in the Ministry of Health and the various units under that ministry. We pray for all of the officials who participate in that work as we seek to build a better Bahamas and to improve the quality of life for all Bahamians. As we participate in this ceremony tonight, we give thanks for all you enable our honoree to do and to accomplish in her distinguished career of public service. and the tremendous example she has given in that regard for others to follow. And we pray that other Bahamians may develop that spirit of devotion to duty and to provide the excellence of dedication and commitment at all times. For all that you have done for us, dear Lord, and all you've done to us, we say thank you, and we invite all present to join in the prayer that Jesus has given us, that we call the Lord's Prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us today our daily bread. Forgive us our trespasses, as we forgive those who trespass against us. Not into temptation, but deliver us from evil. Thine is the kingdom, the power, and the glory, now ever and ever. Amen.
Please take a seat. I would now like to invite PAHO's director, Dr. Carissa Etienne, to say a few words of welcome.
Thank you, Master of Ceremonies, Paul Delacroix. Your Excellency, Dame Margaret Pinling, Governor General of the Commonwealth of the Bahamas, Dr. the Honorable Hubert A. Minnis, Prime Minister of the Commonwealth of the Bahamas, the Honorable Darren Henfield, Minister of Foreign Affairs, Dr. the Honorable Dwayne Sands, Minister of Health, Honorable Romuald Ferreira, Minister of the Environment and Housing, former Prime Ministers Ingram and Christie, Most Reverend Drexel Gomez, former Archbishop of the Province of the West Indies, members of the Diplomatic Corps, heads of international organizations, Dr. Esther de Gourville, the PAHO WHO country representative for the Bahamas and the Turks and Caicos Islands, colleagues PAHO, Sir George Allen, Director Emeritus of the Pan American Health Organization, Permanent Secretaries, our esteemed awardee, Dr. Merceline Dahl-Regis, distinguished ladies and gentlemen, a pleasant good evening to all. I would like to convey my sincerest thanks to you for accepting the invitation from the Pan American Health Organization as we honor Dr. Merceline Dahl-Regis as a public health hero of the Americas. This is the very first occasion on which the ceremony is being convened outside of Washington, D.C. And I am truly honored to share this moment with you, as Dr. Dahl-Regis is a true leader in international public health. She is also a Caribbean woman and a beloved daughter of the Commonwealth of the Bahamas. Since the Pan American Health Organization first established the award for Public Health Hero of the Americas on the occasion of its centennial in 2002, only a handful of men and women have been recipients of this award. It recognizes individuals from the region of the Americas who have dedicated their lives to public health and have made major contributions to improving the health and well-being of people from their own countries as well as regionally and internationally. Dr. Dahl-Regis will be the second Caribbean national and the first Caribbean woman to receive this prestigious award. The list of public health heroes over the past 16 years is indeed a distinguished one, which includes Sir Kenneth Standard, an eminent professor of social and community medicine at the University of the West Indies, who was influential and an advocate for primary health care and the founding president of the Caribbean Public Health Association. The former Minister of Health of Canada, Marc Lalonde, a seminal figure in the field of health promotion. Dr. Myrna Cunningham of Nicaragua, a tireless advocate for the health and human rights of indigenous peoples and women. The former WHO Deputy Director General, Dr. David Tejada of Peru, one of the earliest advocates for primary health care. Dr. Donald J. Henderson, who led the global smallpox eradication efforts, and Dr. Ciro de Quadros, who played a central role in the elimination of poliomyelitis from the Americas, in the establishment of the expanded program on immunization, and the PAHO revolving fund for vaccines. Ladies and gentlemen, it should therefore be crystal clear that the title of Public Health Hero of the Americas is not one that is bestowed lightly. I also know that all of us in this room, and indeed all of those who have worked with, studied under, been cared for, or mentored by Dr. Dahl-Regis, will agree that she merits a place among the distinguished group of public health servants. Thanks for agreeing with me. Dr. Dahl-Regis' list of accomplishments is long, but in addition to their number, there is something quite special about her personal achievements, in that the most important ones in the areas of immunization and the elimination of mother-to-child transmission of HIV and congenital syphilis also happen to be regional achievements. Indeed, they are historic milestones in the annals of public health in the Americas. I do know that Dr. Dahl-Regis takes great pride in the fact that it was Bahamas' Minister of Health, Norman Gay, who challenged his peers during the 1987 PAHO Directing Council to pursue the goal of eradicating poliomyelitis from the region of the Americas. This was well thought out. We have eradicated poliomyelitis from the region of the Americas, and the first region to do so. Dr. Dahl-Regis has carried on that Bahamian tradition of providing leadership for the pursuit of ambitious collective health goals. She has done so within the CARICOM sub-region, in the Americas as a whole, and most recently at the global level. For these and many other reasons, it is truly a pleasure for me personally, as well as in my capacity as the current PAHO Director, to be here tonight to honor this remarkable woman who is eminently deserving of the title of Public Health Hero of the Americas. I therefore welcome each of you to this award ceremony, and thanks for being with us.
Thank you, Dr. Etienne. With these words of recognition for our awardee, it gives me pleasure to introduce Mr. Dylan Stewart, who will provide a musical tribute.
A te l'estremo addio, palagio altero, freddo sepolcro dell'angelo mio, ne a protegge ti valsi. Oh, maledetto, oh, vile seduttore, et o virgin soffristi, rapita lei la virginal corona. Ah, che dissi, deliro. Mi vedo spirito del mesto genitore era serbato strazio d'infamia e di dolore. Il seto alete martiri, pietoso cielo die, resa fulgor degli angeli, prega Maria per me. Resa fulgor degli angeli, prega Maria per me. Prega per me. Prega per me. Prega Maria per me.
Thank you, Mr. Stewart. That was indeed delightful. Please join me once again in a round of applause. Now I would like to call to the podium one of our special guests, Minister of Health, Dr. the Honorable Dwayne Sands, to introduce the Prime Minister.
Excellency, Prime Minister, Director Etienne, distinguished guests, ladies and gentlemen, I stand on the protocol already established. This is indeed a proud occasion for the Bahamas' public health system and the nation as a whole as we celebrate the PAHO WHO World Health Organization Public Health Hero Awardee, our own Dr. Merceline Dahl-Regis. I wish to take this opportunity to welcome the Director and all of the delegates for the recent regional meeting of PAHO. Tonight we are here to honor a Bahamian giant who has contributed mightily to our national development. The award that is being conferred upon Dr. Dahl-Regis is well deserved. And while we have acknowledged her contributions to the advancement of the Bahamas, tonight's celebration frames the magnitude and impact of her work as we see it as a magnificent complement to her international accomplishments. So it is good that our people can see and feel the esteem that she has earned nationally is further validated by our international partners. So while the Prime Minister will no doubt elaborate on some of Dr. Dahl-Regis's accomplishments, I wish to draw particular attention to the era post-retirement as the CMO. In June of 2014, Dr. Dahl-Regis subsequently served as a consultant to my predecessor and is now senior policy advisor to my office. And in this capacity, she has spearheaded the government's public clinic 90-day readiness for the NHI launch and is currently actively engaged in revamping our accident and emergency services and in the development of the polyclinic redevelopment for urgent care. I am still amazed at the skill, the poise, and the stealth that she has used over the last 20 years to convert an acute care specialist heart surgeon into the current Minister of Health. Her foresight and leadership has continued to be of great value to her beloved country, to the Ministry of Health, and to me. And I would like to take this moment to express my personal gratitude for her advice, her guidance, and her unwavering support. I am especially most grateful for Dr. Dahl-Regis' advice as we have sought to improve the delivery of health care at the community level, who encourage health policy makers, in her words, to create a public health system where it is second nature for practitioners to put their clients first, where practice is based on evidence rather than economics, where preventative health care becomes the flagship, providing equitable, culturally relevant care. Ladies and gentlemen, it now gives me great pleasure to introduce to you an individual who has served previously in the capacity as Minister of Health. At that time, 2007 to 2012, he also had the opportunity to work with our honoree in her capacity as Chief Medical Officer. May 2017 signaled a new era in the Commonwealth of the Bahamas. Almost 1 year ago, the Free National Movement candidate for Kalani led the Free National Movement Party to victory in general elections, and he was subsequently sworn in as the 4th Prime Minister of the Bahamas. For the first time, a physician, actually a surgeon, was sworn in as our nation's leader. And since then, he has championed and led a novel approach to tackling the challenges of a modern Bahamas, using an approach that is much akin to the approaches found in public health. If you don't believe me, let me define what public health is. It's the science and art of preventing disease, prolonging life, and promoting human health through organized efforts and informed choices of society, organizations, public and private, communities, and individuals. So our Prime Minister and his team have set about addressing the long-standing chronic, non-communicable illnesses facing the Commonwealth of the Bahamas. And they include crime and corruption, poverty and neglect, economic underperformance, and conventional health, education, and welfare issues. So certainly tonight's celebration of a deserving honoree by a distinguished public health organization will see the completion of this full circle. It is a distinct pleasure to work alongside him as a member of his cabinet in pursuit of the enhanced well-being and health of all Bahamians. I now welcome to the podium Dr. the Honorable Hubert Alexander Minnis, Prime Minister of the Commonwealth of the Bahamas.
Thank you very much. You may be seated. Thank you very much, Dr. Sands. As protocol has already been established, I will adopt, however, allow me to recognize Her Excellency Dame Margaret Pinling, Governor General of the Commonwealth of Bahamas. Ladies and gentlemen, good evening. It is a pleasure for me to participate in this ceremony to present a special award to Dr. Merceline Dahl-Regis, who has given many years of service to the medical profession. Merceline has been a colleague for many years, including my time as a medical doctor and as Minister of Health. Dr. Dahl-Regis began her career in medicine at the Princess Margaret Hospital after graduating from the University of the West Indies. She later pursued graduate studies at Johns Hopkins University in the United States of America. As a pediatrician, Dr. Dahl-Regis has worked assiduously to protect and improve the health of infants and young children for most of her years in medicine. She has also served as an associate professor of medicine at Howard University in the USA. On her return to the Bahamas, she played an integral role in various public health initiatives as Chief Medical Officer, an office she assumed in 1997. During her tenure as CMO, she worked across technical and administrative boundaries to achieve the goals and objectives of the Ministry of Health. Dr. Dahl-Regis spearheaded the drafting of strategic plans for health services. She significantly strengthened maternal and child health care services. This included initiatives to maximize MMR immunization coverage and more emphasis on adolescent health through the establishment of the Adolescent Health Center. She also made contributions in these areas of health policy, both regionally and globally, well representing the Bahamas on the international stage. She served on health-related committees of CARICOM and the Commonwealth of Nations. Dr. Dahl-Regis represented the Bahamas on numerous occasions as a delegate at conferences of the Pan-American Health Organization and the World Health Organization. She served on the executive board of the World Health Organization. She also served as a member and chair of the Strategic Advisory Group of Experts and as member of the Immunization Safety Committee. Additionally, she has chaired the Independent Review Committee of Global Alliance for Vaccines and Immunizations, which supports vaccine procurement through PAHO's revolving fund. In 2009, in recognition of her record of service, Dr. Dahl-Regis was the recipient of the PAHO Award for Administration. And after her retirement as Chief Medical Officer, she worked as Senior Policy Advisor to the Minister of Health and worked as the Registrar of the Bahamas Medical Council. She continues to bring her knowledge and skills to bear on various aspects of public health and continues to mentor young physicians. Ladies and gentlemen, this year we celebrate 45 years of independence. This observance provides the opportunity for us to reflect on our post-independence journey and the stories of Bahamians like Dr. Dahl-Regis, who has, as eager young students in the years prior to independence, were able to envision how their communities and country might benefit from their talents. These social entrepreneurs set goals for themselves. They remained steadfast in pursuit of those goals until they were achieved. And since independence, we have seen tremendous progress in the provision of health care in our Bahamaland. However, an emerging trend with which we are now faced that pertains to the prevalence of chronic non-communicable diseases is undermining our progress and has led to dramatic new challenges. The treatment of medical conditions related to chronic non-communicable diseases requires public funding, which could be allocated to other priority areas of healthcare delivery. CNCDs have implications for the productivity of the workforce due to illness and disability, all contributing to the undermining of our country's potential for further economic growth and national development. There is also the reality that many of the individuals whose lives we were able to save over the years by inoculation as infants against vaccine-preventable diseases are now adults whose lives will possibly be lost prematurely or seriously affected by chronic non-communicable diseases. Ladies and gentlemen, just as we are committed to sustaining the gains in immunization coverage against communicable diseases, we are also committed to further enhancing the focus on reducing the need for hospitalization as a result of complications associated with CNCDs. The Ministry of Health has recently announced initiatives to further promote healthier food choices and combat sedentary lifestyles. We are emphasizing the message of prevention and anticipate that in the long term, these initiatives will enable more Bahamians to live healthier and longer lives. We regard this as a war against CNCDs, including the risk factor of obesity, as one that we can win. It is not, however, one to be fought exclusively by the Ministry of Health. Our vision includes an emphasis on personal responsibility and a variety of social and health policies geared toward helping to redirect certain choices which may lead to ill health and obesity. Tonight, I wish to express the deep appreciation of the Pan American Health Organization of its ongoing support in numerous aspects of public health programming and policy. PAHO, which serves as the regional office of the World Health Organization, is the oldest public health organization in the world. The technical assistance it provides to its member states is noteworthy in a region where most of its members are categorized as developing economies. It is a matter of great pride that through the technical expertise of Dr. Dahl-Regis, the Bahamas has been able to make significant contributions to this work of PAHO in interventions associated with efforts to eliminate vaccine-preventable diseases. Last week, we celebrated as Vaccination Week an annual health observance of the Pan American Health Organization and the World Health Organization. It is therefore fitting that the week that recognizes the benefits of immunization has culminated with the receipt of this prestigious honor by Dr. Dahl-Regis. It is my tremendous honor to salute Dr. Dahl-Regis. I thank you on behalf of the government and people of the Commonwealth of the Bahamas for the many years that you have given in service to the Bahamas and to the world. You are a national treasure. Let me also thank your family and friends for their support for you over the decades. Your work has helped to save many lives. Your country owes you a tremendous gratitude. Generations to come will benefit from your vision and your dedication. Congratulations, Dr. Dahl-Regis, and may God continue to bless you, and may God bless the Commonwealth of the Bahamas. Thank you very much.
Thank you, Prime Minister, for your kind words, and thank you also to the Minister of Health, the Honourable Dwayne Sands. As you may know, over the years, PAHO has recognized public health heroes for their invaluable contribution to public health in the Americas. Our heroes come from a broad spectrum of backgrounds and fields of work and share one common goal: improving the health and well-being of the peoples of the Western Hemisphere. Tonight, of course, we are welcoming our newest hero, our honored guest, Dr. Dahl-Regis. But first, to help you get to know her, we'd like to tell you something about her path through public health here in the Bahamas, in the Caribbean, and in the Americas. This short video will tell us a little bit of her personal story through her own voice and the voices of some of her close colleagues. May we have the video, please?
I had an early exposure to healthcare. Culturally, when, as children, you're sent to the family islands every summer when school closes. And I stayed in Cat Island, one of the remote islands, with my aunt, who was a public health nurse. In fact, she was the only health provider on the island. And I had that exposure. And I made the decision to go to medical school. At that time, it was not many females were going to medical school, but I'm a risk taker, so I went. I got a scholarship. I did well in my exams, and there was the opportunity to go, so I said, I'll do it. And then Georgetown University had a clinic here in the Bahamas, and I was exposed to that, and I was invited to go to their pediatric program. In addition to that, I had family members who were in Washington and who thought that I should go to Howard University. So I was offered a contract before I left the island, actually, to do pediatric residency. And when I was finishing my residency, I was offered a faculty position at Howard. And I took it, and by that time I was married with a child, and my husband was also at Howard. And so I took the opportunity to work as a faculty member and rose in the ranks and actually achieved tenure status. In the meantime, I always wanted to come home to work. And I worked with developmentally challenged individuals and saw what could happen when you don't engage in preventative medicine. And I started public health at Hopkins, and I came home to do the sabbatical. I was invited, because of the work, I was invited. When the chief medical officer's position became available, I was invited to return as CMO.
Well, I met Dr. Dahl-Regis firstly she was a student, and we crossed in medical school. She was several years behind me, but I remember her having come from the same high school as I did. And I encountered again, we met again when I was appointed Minister of Health.
And 1 year into that experience with Dr. Knowles, I looked at the congenital rubella syndrome cases that were occurring in the Bahamas. And we were getting ready to do a mass campaign, a supplemental campaign. And so given the epidemiological training I had at Hopkins, I looked through the regional records and saw that there were some countries in the region, like Barbados, that were immunizing women in the reproductive years. And then I went to their records, and they were having congenital rubella syndrome. And as you put the linkages together, you realize that the men were the reservoirs for the virus as well. So we decided that if we're going to truly impact immunization and prevent CRS, they supported the implementation of the campaign that involved immunizing men and women and children.
I first met Dr. Dahl-Regis in person in 1997 when she returned to the Bahamas as the Chief Medical Officer of Health. And of course, in her very concerned way, she developed a very special program, maternal and child health program, from which emerged the adolescent health program.
In terms of infant mortality reduction, it took a while, it took years, but we were able to reduce the infant mortality rate in half during a period of 5 years.
We were transiting or at least developing a community health service. And so together we worked with developing a clinic in the South Beach. It's called our South Beach Clinic, which really was a clinic that provided services to children, for example, ear testing, hearing testing, and also vision testing.
Well, definitely she would have, her achievements relate to the fact that she would have received the PAHO Administration Award a few years ago. If you've ever seen Dr. Dahl-Regis function in an international or regional setting, you immediately know that she has gained the respect of many, and many people actually covered her wisdom and her opinion. And I think that that speaks volumes to how she has been able to elevate the conversation around health, but also elevate the Bahamas in her conversations around health, both on the national, regional, and international stage.
I served on as a member of the WHO Executive Committee. Dr. Margaret Chan, who was the director of WHO, said to me, well, I read all the papers and participated fully in the event, and they found me rather challenging, I guess. She said to me, you take on the big boys, don't you? And I said, why not? You know, so the beauty of WHO is one country, one vote, and you have regional representation that's rotating. So it provides opportunity for people who come from a small island community, only 300,000, to work with the Brazilians, to work with the Africans, the Emeralds, and all the other group. PAHO was a very good experience. The Bahamas had the opportunity to be on the executive committee of PAHO. I learned a lot from that experience on the committee and working with the program, the subcommittee on program and planning. To the director of PAHO and the Director General of WHO, this is your legacy. To the ministers of health assembled here today, your colleagues, your children, your grandchildren, and generations to come will be able to see you in that photograph on this day when we have declared the Americas free of endemic measles transmission. Thank you. It was difficult to achieve elimination of measles, rubella, and congenital rubella. There were challenges for measles elimination. We recognized that there would always be importation of measles. However, if you have a certain level of herd immunity, you would interrupt endemic transmission of measles.
The work that she has done in terms of ensuring that the CMO's report was there, ensuring there was a reduction in the mother-to-child transmission from the HIV and the AIDS program. Significant. The kind of work that was carried on ensured that we now have an accredited research lab dedicated to that work here in the Bahamas?
It gives me great pleasure. I feel prideful in standing here this evening, recognizing the good work that the countries have done, the accomplishment we have made as a sub-region, as a region, and in the world. We have done it. We knew we could do it. 7 Caribbean countries have achieved, of the 11 countries of the world, 7 are from the Caribbean. I am not only proud of the achievement, but the capacity building that resulted as countries embarked on the initiative.
Dr. Dahl-Regis is deserving of this award because she exemplifies, I think, a lot of the characteristics of a leader. She's inspiring, she's encouraging, she has integrity, she has courage. But I think beyond that, she is extraordinarily humble, and she sees the humanity in others. Maya Angelou once said that a leader sees the greatness in somebody else, and if he or she cannot identify that greatness, if he or she only sees himself or herself, then they're not a leader. And I think above all, she's deserving of this because she sees greatness in other people and not just in herself.
This recognition of the work that I've done in public health does not belong to me alone. I could not have achieved the work that I've done without the contributions of so many, particularly the health workers in the field, the staff at all levels, my family, particularly my late husband, my children, my immediate family, very good friends, and lots of prayers, faith and prayers. Could not have achieved this recognition. And I am truly grateful for being recognized as a public health hero. That's all I can say.
With Dr. Dahl-Regis' story fresh in our minds, I would like now to invite Dr. Merle Lewis, Chief of Staff of the Pan American Health Organization, to introduce tonight's honoree. Dr. Lewis.
Thank you very much, Mr. Chair. In the interest of time, I will adopt the protocol that has already been established, but I would like to say a special good evening to Your Excellency, Dame Pindlin, the Governor General of the Bahamas. It is with immense pleasure that I stand here with you this evening to honor someone that I have long respected and admired for her unbridled passion and strategic visioning for public health, her genuine compassion for people and the human condition, her political astuteness and persistent advocacy, and her enduring Christian faith amid dark clouds of adversity. This woman is Dr. Merceline Dahl-Regis, one of the pioneering women in public health in our region. As noted by Dr. Etienne, Dr. Dahl-Regis' accomplishments are in some way a mirror image of the recent chronicle of public health successes in the Americas, including some historic milestones to which she has contributed in important ways. allow me to share with you a few salient highlights of this very distinguished career. Dr. Dahl-Regis was among the first Bahamian women to obtain medical degrees during the 1960s. She later trained as a pediatrician, and during her early medical practice, she recognized that those public health essentials, such as access to clean water and basic sanitation, good nutrition, and access to vaccines were important. She became a strong, passionate, persistent, and effective advocate for all of these issues. Dr. Dahl-Regis received her medical degree from the University of the West Indies in Jamaica and a master's degree in public health from the Johns Hopkins University School of Public Health. She is a diplomate of the American Board of Pediatrics and a fellow of the American Academy of Pediatrics. She has had a distinguished career as an associate professor of medicine at Howard University and as the director of its Child Development Center in Washington, D.C. She has served as an outstanding attending pediatrician at many hospitals and clinics in Washington, D.C., Maryland, and Virginia. In the early 1990s, Dr. Dahl-Regis played a pivotal role in strengthening maternal and child health services here in her homeland, with support from PAHO's Latin American, Caribbean, and Caribbean Center for Perinatology, Women and Reproductive Health, known as CLAP. On assuming the post of Chief Medical Officer of the Bahamas in 1997, she established the Comprehensive Adolescent Healthcare Center in Nassau, the first of its kind in the Caribbean, and she promoted the expansion of maternal and child health services across Nassau and the Family Islands. She produced 2 National Health Services Strategic Plans, 2000 to 2005 and 2010 to 2020, both of which included significant reforms for the delivery of health care in local communities and for inmates at Her Majesty's Prison. As part of her enduring commitment to primary health care, she was a strong advocate for capacity building of the national health workforce, encouraging many of her staff to complete undergraduate and graduate degrees abroad. Health professionals whom she has mentored have joined organizations including the Pan American Health Organization, the U.S. Centers for Disease Control and Prevention, and UNAIDS, among others. In 2009, Dr. Dahl-Regis received the PAHO Award for Administration in recognition of her contributions to healthcare management and research and to medical education in primary healthcare. She was a key actor in contributing to CARICOM becoming the first sub-region of the Americas to eliminate indigenous transmission of measles, an achievement which has been maintained for more than 25 years. Additionally, it is important to note that the extensive regional initiatives undertaken by PAHO to eliminate endemic transmission of rubella virus and congenital rubella syndrome were very much anchored on the lessons learned from some of the pioneering public health work undertaken by Dr. Dahl-Regis. Through her visionary technical leadership and concerted public health action, the Bahamas became the first country ever to conduct a rubella vaccination campaign targeting both adult males and females up to 40 years of age in order to interrupt the transmission of that virus. Switching perspectives, it should also be recalled that Dr. Dahl-Regis has made numerous significant contributions to the Caribbean, the wider region of the Americas, and globally through her membership and active participation on a variety of committees and boards. Her fellow CARICOM chief medical officers unanimously nominated her to serve on the steering committee that oversaw the merger of the 5 regional health institutions into a single Caribbean public health agency known as CARFA. Her contributions to that restructuring exercise were thorough and invaluable. She was also an effective board member of the Caribbean Accreditation Authority for Medicine and other health professions, as well as an integral part of the initial group that worked on the formation of the Caribbean Association of Medical Councils, CAMC, which standardized recognition of medical qualifications across the Caribbean region. Dr. Dahl-Regis was Bahamas' chief delegate to the World Health Assembly from 1997 to 2012 and an active participant on both PAHO's executive committee and the WHO's executive board. As a member of the WHO executive board, she was a strong and effective voice in articulating those health challenges faced by CARICOM and efforts to overcome them. In recognition of her leadership during the final year of that representation, she served as the chair of WHO's Program Budget and Advisory Committee, PBAC. She has been both a member as well as the chair of WHO's Strategic Advisory Group of Experts, SAGE, on immunization, and also a member of the Immunization Safety Committee. For more than a decade, she also served as a member of the Gavi Alliance's Independent Review Committee, eventually assuming the position of chair. In 2010, when PAHO created the International Expert Committee for verification of the elimination of measles, rubella, and congenital rubella syndrome, the organization turned to Dr. Dahl-Regis to lead the foundational work of this committee. Her tireless commitment and persistent diligence, her sharp technical knowledge, coupled with a deep understanding of the different country contexts, and her exceptional political and diplomatic skills, all kept the verification process on course, despite significant challenges. Indeed, her leadership and integrity were key factors in maintaining elimination efforts on track. These stellar contributions earned Dr. Dahl-Regis widespread respect, such that she was subsequently requested to provide guidance for verifying the status of measles and rubella elimination initiatives in other regions of the world. In 2014, she once again demonstrated these leadership qualities and competencies in her work as chair of PAHO's Regional Validation Committee for the elimination of mother-to-child transmission of HIV and congenital syphilis in the Americas. Her contributions to this endeavor were key to the progress and success of the Dual Elimination Initiative. She supported the development and refinement of validation methodologies, tools, and processes that have since been adapted and adopted at the global level. It was therefore not surprising when she was called to chair the Global Validation Advisory Committee when it was created by WHO in 2015. Dr. Dahl-Regis's most notable accomplishments are part of the impressive history of Pan-American cooperation in health. As was the case with smallpox and poliomyelitis, our region became the first to eliminate measles and rubella in 2015 and 2016, respectively. Cuba first, and later 6 other Caribbean countries and territories have been validated as having eliminated mother-to-child transmission of HIV and syphilis, while 13 others are reporting data consistent with dual elimination. I am very sure that Dr. Dahl-Regis would be the first to indicate that all of these achievements are collective ones. I would even hazard a guess that she would say that she shares this honor that we are bestowing on her with many healthcare workers, public health professionals, volunteers, and others whose individual and collective efforts have been vital in reaching these important regional milestones. That, of course, would be true, and none of us would question it. As important as are the contributions of all of those unsung heroes, some unique qualities have placed Dr. Dahl-Regis at the center of these achievements. These include her respected leadership, her scientific rigor, her personal passion, her commitment to health equity, and her belief in the power of international solidarity in health. These are the qualities that make her a model of regional public health leadership and more than worthy of this title of Public Health Hero in the Americas. It is a pleasure and honor for us to bestow that title upon her. Finally, I would like to recall a few words from her acceptance speech for the 2019 PAHO Award for Administration, which Dr. Sands has actually quoted, and I quote again, "I envisage," this is what she said in 2009, "I envisage a public health care system where it is second nature for practitioners to put the client first, where practice is based on evidence rather than on economics, where preventive health care has become the flagship of healthcare systems globally, providing equitable and culturally relevant care." On behalf of the PAHO director, Dr. Etienne, I am happy to report that some 8 years later, we as a region have fully embraced the aspirations of this public health hero and have commenced implementation towards achieving those goals under the rubric of universal health. We will continue to work together in the spirit of Pan-American solidarity to achieve the 2030 Sustainable Development Goals, ensuring that we leave no one behind. Our warmest congratulations and sincerest thanks to our public health hero of the Americas, Dr. Merceline Dahl-Regis. I thank you.
I would now like to invite our esteemed awardee, Dr. Dahl-Regis, to the podium to receive her award as the newest PAHO Public Health Hero of the Americas from the PAHO Director, Dr. Carissa Etienne. Dr. Dahl-Regis and Dr. Etienne, please. Please join me in a round of applause for Dr. Dahl-Regis. At this time, and before we have two personal tributes, we will show another video, actually another two short videos.
My name is Rudolph Cummings. I am the Program Manager for Health Sector Development at the CARICOM Secretariat and formerly the Chief Medical Officer of Guyana. I have known Dr. Merceline Dahl-Regis for well over 20 years. I think if I recall correctly, first met her in 1994 in Jamaica when we attended a conference of maternal and child health officers of the Caribbean community. She has always impressed me as being a consummate professional, very, very thorough in her work and very supportive of regional endeavors. And she has been one of the persons who has helped to reform a number of things that we inherited from our colonial past and make them more relevant to the Caribbean community. The renaming of CCMRC to CHRC before its absorption into CARFA was one such event, and I recall that in 1999 at a meeting in Ocho Rios, she made two particular points. One of them is that the configuration of the scientific committee did not seem to have any female voices, and immediately there was change at the next meeting of the Council for CCMRC. It was also renamed to CCHRC because she was particularly concerned that the Caribbean needed as much health research as medical research, health being the broader issues which create or are responsible for human well-being, and medicine being largely curative. She, besides this, has been a major voice whilst as maternal and child health officer in the evolution of the immunization program across the region. I believe that it was during her time as maternal and child health officer that we got very much involved in supporting both the regional endeavor to eliminate measles, which later became global. And in the final days of that campaign or that strategy, she was part of the regional committee for the certification of the measles-free status of the region. We've had some recent setbacks, but her contribution at that international level has been well recognized and well respected. The last time that Bahamas served as on the WHO Executive Board, she distinguished herself by serving as chair of the WHO Program Budget Committee. And Dr. Margaret Chan, the former Director General of WHO, was very high in her praise of what she considered to be very diligent and thorough work that she did during her tenure. Dr. Dahl-Regis is well known to people of my generation as a very, very competent and caring public health professional. During our deliberations and the formation of the Caribbean Public Health Agency, her contribution was as equally remarkable as those of all the other public health professionals from the member states who participated in the deliberations. I think in recognition of this, she has already had one high PAHO award, And this one, which she's about to receive in a few days' time, is certainly worthy of the diligence and hard work and commitment which she has put in, not only into Caribbean public health, but into public health across the Americas and the world. And so, congratulations to you, Dr. Dahl-Regis. The two of us go a long way back. I always tell people in the interregia between meetings, we play tennis together. People don't know that you're still a tennis player, but that's a long time ago. And I wish you well and continued health as you continue to serve your region. Thank you.
Hello, Merceline, my dear friend. Congratulations on this auspicious occasion to recognize your contribution to public health, not only in the region of the Americas, but the world. When PAHO, the Pan American Health Organization, called me to provide this address, I was delighted and honored to do so. If I could be there, you know in my heart of hearts, I'd certainly be there with you on this auspicious occasion. But I'm on my way actually to Thailand for a measles consultation that I'm sure you, it's dear to your heart as well. Many of you there in the room know about Merceline's background and her contribution, but I wanted to highlight a few things because I think it really points out her incredible contribution to the health of the world's children in particular. Merceline started off with her medical degree from the University of West Indies and then went on to get her Master of Public Health at the Johns Hopkins University School of Public Health. Merceline worked as a staff member in many of the Washington, D.C. area hospitals and clinics when she was a young physician. She also earned an associate professor degree at the Howard University, so her academic career was also blossoming in her early days. And I think through this period, I feel, I would guess that Merceline gained a recognition of the importance of mentoring and nurturing a younger generation of health professionals and providers. She, throughout her career, this has been a guiding force for her, always being there to mentor and help guide younger health professionals. When I came back to PAHO in 2003 to lead the immunization team, Ciro de Quadros told me that you need to meet Merceline. She's a dynamic force. Merceline, after her work in Washington, D.C., was asked by her country, the Bahamas, to come and be their chief medical officer. I believe it was in 1996 or so. She returned and had been working in that position. So when I came in 2003, I immediately contacted her, and I have no regrets. It's been a wonderful collaboration and a friendship that I think has developed. I really learned so much from Merceline in her role as a leader that's passionate and committed to the cause of health. And she recognizes the value of vaccines and has always been a champion of immunization. She has served on the WHO Strategic Advisory Group of experts and chaired that committee as well. She was the chair of PAHO's Regional Commission on the Verification of Measles and Rubella, did outstanding work and saw and provided oversight to the certification of measles and rubella elimination in the region. An incredible contribution to the health of our children. Merceline has held a number of other positions with UNICEF, providing her expertise to evaluate programs. She led a team that evaluated the Gavi immunization program and has been on, as I mentioned, a number of other committees and programs of WHO. In her position as the Chief Medical Officer of the Bahamas, she always led the team that went to the World Health Assembly. And what I quickly learned was that Merceline was not only a voice of the Bahamas, she was a voice of the Americas. You could always count on Merceline to present an issue that was critically important for the health of the Americas, or an initiative that we were trying to achieve, such as measles elimination. We've always been challenged to mobilize the support and commitment from the rest of the world to eliminate measles, because as long as there's virus anywhere in the world, we know that we're at threat for imputations. And Merceline was a champion of that cause, and I want to thank her from the bottom of my heart for all the work that she's done. I think she would say, if I was to guess, I think she would say that she's probably most proud of this passion and commitment that she's had throughout her whole career to mentor, to guide and supervise the next generation of public health and medical providers. And that's an amazing contribution, aside from all the other things that I've mentioned, and particularly with her leadership for measles and rubella elimination and other immunization services. So if I could be there, wild horses couldn't keep me away, but I unfortunately can't. I'm honored and delighted to be able to thank you, Merceline, personally, on behalf of, I hope, many, many other people in the Americas, for what you have done over your lifetime. And let me say this, that it's not over. I'm sure we'll all be looking for you, for your leadership and guidance and your passion and commitment. So thank you, dear, dear Merceline.
Thank you very much for these videos, Ari. I would now like to invite Dr. Sir George Alain, PAHO Director Emeritus, to come forward for a personal tribute. Dr. Alain.
Mr. Master of Ceremonies, Your Excellency, Mr. Minister, Director PAHO, PAHO WHO Representative, Dr. Merle Lewis, Chief of Staff, all you distinguished ladies and gentlemen, Dr. Merceline Regis, all of you are distinguished, but let me single out one for whom I think is exceptionally distinguished, Dame Ivy Dumont. It is so good to see you, Dame Ivy, here. I have great affection for your leadership and your counsel over the years. It is very difficult to add anything factual to what has been said about Dr. Dahl-Regis, and I perhaps should just say amen and sit down, but I will not. I will. In days of yore, when people brought tribute, they brought silver and gold. Silver and gold have I none. But what I do have is a recollection of many years, a recollection and admiration over many years of what you have done. When I was a little boy growing up under the British Empire, or as Tom Clark would say, growing up stupid under the British Empire, we learned songs like some sing of Alexander and some of Hercules, of Hector and Lysander, and such great men of these, and all great heroes. And then when I went to Harrison College, I read Virgil's Aeneid, which begins, I sing of arms and the hero. And you started to think that all heroes were men who bore arms and fought great battles. And you were brought up to believe that the only way one could be outstanding and be named a hero, and they were mainly men, well, you had to bear arms. But what we've learned over the years is that the heroes of different colors. There are heroes with different attributes. And there are few that display these attributes more than Merceline Dahl-Regis. When I told Sylvan that I was coming, she made sure to remind me to say, congratulations, Sylvan, my wife, congratulations on her part. They both have sorry tales and scars to bear over their time at Howard. Sylvan also taught at Howard. And when they get together, sometimes they swap tales of what did or did not happen at Howard University, of which I will not recount here this evening. But Merceline, when Dr. Etienne spoke of the heroes of the Americas over the years that were nominated at the 100th anniversary of PAHO, this was quite a trying time to find, of the hundreds of people, the thousands of people who have contributed to the health of the Americas, to find a couple, a dozen, I think it was 10 at that time, who were genuinely outstanding. But over the course of the years, and as I have watched the evolution of the designation of Health Heroes of the Americas, I am impressed how we can find persons whose dedication, about whose dedication there can be no reservation, about whose contribution there can be no quibbling. And you stand in line of a series of men and women of that ilk, about whose dedication there can be no quibbling. We speak of, you've heard about the pride with which Merceline speaks of the elimination of measles from the Americas. An interesting aside, as Dr. Etienne referred to it, when we thought of the elimination of measles from the Americas, and when the elimination of these diseases was brought up by Gay, your Minister of Health, it was pointed out it was fitting that they should take place, that the announcement should be made by a Minister of Health of the Bahamas, because that was the place that the Spanish tourists first brought these diseases in the first place. And there was fitting that a Spanish minister of, that a Bahamian Minister of Health should articulate for their elimination. But a Bahamian minister having articulated so clearly for elimination, how fitting it is that another Bahamian national should be one who has spearheaded much of that accomplishment. How fitting it really is. Merceline, I am proud of you for many reasons. I'm proud of you, of course, I'm proud of you because you went to our medical school. I am proud of you because over the years, you have dedicated a steadfastness. There are many people whose accomplishments are up and down, up and down, up and down. One of the things I've admired about you, Merceline, is the steadfastness with which you had followed your particular career. The steadfastness with which you have followed what you believe to be the right thing to do for the children of the Americas and the world. When we hear of, we read of the elimination of these various diseases, sometimes we think of it in the abstract. But I think on one occasion when we spoke about it, you and I spoke about it, you thought of it not in the abstract. You thought about it of the numerous children of the Americas, none of whom have now to walk with crutch or caliper. You think of it in terms of the children of the Americas for whom, when they go to their pediatrician and they have a rash, never does the thought of measles enter it. You think of it in terms of the youngsters who we never think of having congenital rubella syndrome. It is the human aspect of these things, how you have thought of the human aspect of these things, that I think sets you aside as a hero. Not only the accomplishments, but the human aspect of it, which has permeated your work, which I think is one of the remarkable things. But there's another reason I'm proud of you. Many of us speak, but few of us can articulate the logical position to such an extent that we can convince the others. And I am proud when I hear Merceline in an international forum articulating the logical position so cogently and so clearly that even if there's disagreement, at least there's a sensible disagreement, and out of that disagreement can come a consensus, which is usually to the betterment of the health of the regions. I'm proud of you for that reason, Merceline. I am proud of you because you exemplify what I consider the three essential V's which make for greatness. There are values, there is vision, and there's vigor. the values that you hold and you've demonstrated over your career, many of which have been set out in the various descriptions of what you've done. There's a vision you've had of a world that is better, and the way in which you have in your corner tried to make that world better, and the vigor which you have pursued it. The unwavering vigor in which you have pursued these goals is something of which I am really very, very proud. Many of you have heard of Merceline's achievements and have thought that all she does is work. That's not true. That's not true. She is great fun. She enjoys a joke and tells a good joke sometimes. And for that, a person who is multidimensional, who is not only concentrated or has concentrated only on her work, but has time to enjoy the other aspects of life, I am also proud of you for that. Merceline, in the words of the old song, you're once, twice, 3 times a lady.
Thank you very much, Dr. Lane, for those wonderful words. Before we hear from Dr. Dahl-Regis, let us pause for another musical tribute performed by Mrs. Candice Bostwick.
Climb every mountain, search high and low, follow every byway, every path you know. Climb every mountain, ford every that will need all the love you can give every day of your life for as long as you live. Climb every mountain, ford every stream, follow every rainbow, till you find your dream. A dream that will need all the love you can give every day of your life for as long as you live. Climb every mountain, ford every stream, follow every rainbow, till you find your
Thank you, Mrs. Bostwick, for that beautiful performance. I would like now to invite Dr. Merceline Dahl-Regis, our new PAHO Public Health Hero of the Americas, to share her own thoughts with us tonight. Dr. Dahl-Regis.
Good evening. I've heard a lot of good things about myself this evening. Dame Ivy asked you to tolerate me when I first came to the ministry because of my foreign disciplined ways. Good evening, Madam Dame Ivy. Dame Marguerite, she's ever present in my mind. Protocol to all the distinguished platform guests, to my dear friends, all those in the audience, thank you for being here. This award is for all the healthcare expert staff, domestic and international, who toil in the fields, risk their lives, lose their lives, and who often endure conflict situations, all to protect the lives of many, including our children, born and unborn. I would remind you that we had our first vaccine only 2 centuries ago with Edward Jenner, who inoculated the scrapings of cowpox into a child who then became immunized against smallpox. It's not that long ago. If there are any persons in the audience who are over 50, there may be a few of you, would have scars on the left arm from smallpox vaccination. those under 40, I'm sorry, you don't have it, and if you have anything, it's a tattoo. We owe a debt of gratitude to so many that have led public health, and I am particularly fortunate to have had the occasion to, as a student, to work with Sir Ken Standard, with Sir George Alene, with its Dr. or Sir Frank Ramsey in Barbados, whom I learned a whole lot. I met D.A. Henderson, who's responsible for the eradication of smallpox, as a student at Hopkins. Fast forward now to 1997, when we met with the PAHO consultants here in Grosvenor Close at the School of Nursing and proposed to them the elimination of congenital rubella syndrome and inoculating men and women. We were challenged, and immunization will always have challenges. When we started this in 1997, we had the group, the logistics, we had to calculate how many men would be in the reproductive years. We know women finished at 40, but the men, you know, so our figures were off. You know, we were using strains of Sabin and Leningrad, and we had to change that. We had a brilliant social communications team, and we prevailed. And we have not had a case of congenital rubella syndrome since 1998. My country is proud. We led, the Caribbean followed, and not enough can be said about what happens with the leadership in the Caribbean in terms of advancing health, the health agenda and the prevention and control. And the minister has left, the prime minister has left, but we also led with CNCDs. Many of the folks who worked with immunizations are here, and I greet all the PAHO representatives here and say thank you for all that you have done for the Bahamas. And much is credited to Pan-Americanism. What's that? Pan-Americanism is commitment, solidarity, and leadership. And I'm sure Dr. Gomez and Dr. Etienne would remember that directing council when we sought to preserve a fund that provides vaccines to all in the Americas, whether or not you can afford it or you have a deferred payment. And the group, Dr. Chris Etienne was the new director, and she lent her support to all the people, all her team, to help the Caribbean, who coordinated, choreographed a beautiful 36 interventions, beat back the vaccine giants from Copenhagen, from Geneva, from the US and Canada, and we were successful putting that flag up. Dr. Gomez waving that flag, we would always remember how we achieved that. And again, Margaret Chan was in the room, and she's immediate past director of WHO. And when she passed me with her quick steps, short steps, she says, "You take on the big boys again." I said, "Why not? You know, we must, you know." But together we achieved, Pan-Americanism has achieved a lot. And in the Bahamas now, we offer immunization, 17 vaccine preventable diseases in the public sector and private sector, free of charge. And the revolving fund has helped us do that. We weren't always in that position. And I recall a very cold autumn morning when we were directing council, when Dame Ivy and Mrs. Sayers and I boarded a bus and went to Front Royal, Virginia, to meet with the vaccine manufacturers of Haemophilus influenza B. And at that time, it was $55 a dose. The revolving fund now is 2 cents per dose. Yeah. And I was asked to justify why we would spend such money for Haemophilus influenza B, given the very elegant studies of CDC, etc. And I said, okay. I went to the hospital records. 1 year, pulled all the records, counted the meningitis. They were 50 plus, and they gave in. They allowed Haemophilus influenza vaccine to be added to the regimen at that time. And I say to you, the wards are empty in pediatrics from vaccine-preventable diseases. No more. Yeah. And in 1974, when I did my internship, we had, the scene is very different now. And I'm so proud of all the workers, the nurses in particular. They are to be commended for their work. You've heard that I've worked with the Gavi Alliance, and I thank Dr. Knowles and Ms. Salke for allowing the Bahamas to participate at the ground level with the Bill and Melinda Gates Foundation and UNICEF. And now it is estimated that 23 million child deaths will be averted between 2011 and 2020. And I think, I say thank you on behalf of those whose vision to get Gavi started, the work with WHO, and all the immunization biologicals team that we have worked with. In the British Medical Journal last year, there was a publication that showed the return on investments for immunizations. And it is no doubt that it is the best public health investment of all times. And we must preserve it and we must maintain it. You've heard of the challenge we met with the region of the Americas and the International Expert Committee. I want to say thank you to Dr. Roses for Mirta Roses for her vision and the work that she supported, to all the countries, to all our governments that made this happen. It was truly Pan-Americanism in its full regalia, and I want to thank you. I've mentioned to you that we have turned back a lot of diseases. We have a challenge with cancer of the cervix and the HPV vaccine. And tonight I want to acknowledge the pioneering work that Dr. Lewis did at Hopkins and at Carrick, and to say a special thank you for that great work that has put us in this position that we're in tonight. And I want to throw a challenge out to all here that we can impact CA the cervix in 10 years. We may even go to some zero. I think we can do it, and the team here in the Bahamas, we're immunizing school-age girls and boys, and I think we can do that. We've accomplished a lot, but we're fighting a global campaign now, and I'd like to say to a special challenge to Mr. Bose and Ms. Lasser from DCRPS, Ameriprise, and all those other corporate groups, to say that we need help in combating vaccine refusers is a campaign, a growing campaign, and it will undermine all the successes that we have had with immunization if we allow it. And we need to mount a global campaign. And I invite everyone to put their heads together and see how we're going to combat this. It is a real problem, a growing problem. That's what affluence does sometimes. I am very proud of my country. Very, very proud. And I'm proud of the public health leadership. It was here at the British Colonial Hotel when we laid the foundation for the elimination of mother-to-child transmission with Dr. Gomez and his team. And we're going to get there. It's going to take a while. We're now working on the path to elimination for some countries, but the Bahamas can do it. And we hope to join that League of 7 soon. You've heard of all these accomplishments. Then why do we have to be penalized for our successes at WHO? I say to you, Director, every year we go to WHA, we do not have equitable distribution of resources, financial resources across regions. And to the team going to 71 WHA, we have to do something about this. And I know the judge is looking at me, but I think we ought. I'm up for a challenge, although I'm not going to be there. But it's important that, when we look at the infrastructure, the public health infrastructure throughout the Americas as we did the validation, it is not stagnant. It needs significant support and investment. And we need not be patting ourselves on the back on the good work we have done. We have to maintain what we have done. So I ask you to meet the challenges. It was Stokely Carmichael who said in his book, Crisis in Black and White, that you cannot expect to cross the ocean without the roaring waves. And there would always be challenges. And so we must meet these challenges head on. And we have done that. The Bahamas has many undocumented successes. When you read the recent article in the New England Medical Journal and the Lancet, you recognize the impact of non-state actors and the impact of particularly the pharmaceutical industry. And when we look at the work of the Bahamas Medical Council under Dr. Walkeen and the council members and now Dr. Weish, we recognize that it was visionary to put in place CME credits that were free from commercial interests or to have full disclosure. That is significant. Plus, the Medical Act is really a good piece of legislation that is going to move the health agenda forwards. When we look at, I see Dr. Knowles, we no longer have conch poisoning. When he was minister and I was CMO the early years, the emergency room was chock-a-block with conch poisoning. We no longer have hepatitis A outbreak in daycares. We have improved water security. We do not have endemic transmission of malaria nor Zika, and I thank you for looking at the PAHO team that helped us to document that. When we looked at the dengue outbreak and the work that did to mitigate dengue infection, that served us so well that when the rest of the region had chikungunya, we didn't have the number of cases of chikungunya. We have no yellow fever. Where do you have a Category 5 hurricane without a single death? We have done a great job. And that's due to the leadership, successive administrations. And we certainly thank all of our folks, our leaders, our past prime ministers, ministers of health for their good work. I'm sorry Dr. Minnis has left because I wanted to thank him in advance for the impending redistribution of resources to public health. And I wanted to also tell him that that under the leadership of the Minister of Health, Dr. Dwayne Sands, and the UWI team and the council, that in July, yeah, I'm leaving in June, so in July, we're going to have a 2-year foundation program that will staff, Dame Ivy, staff all islands of the Bahamas in a very few short years. We're going to do it. And that's support with all our health institutions, public and private. We have a plan. The minister is going to lead that charge, and the council is going to support it. In closing, I want to express my profound gratitude to all the many permanent secretaries with whom I have worked, and whose vocabulary was expanded with medical terminology. Mrs. Garraway is noteworthy. She uses the terms quite well. Testicular fortitude, she likes to say. But when I told her, oh, you've done such a marvelous job, you're just like the epididymis, she didn't know what I was talking about. And so, George, when I told her where the epididymis was, oh, she would use it. I want to note the accomplishments of my very young team with whom I worked at the ministry. I'm so proud of you, all of you. And together we've achieved much. And I thank you for your affection and your respect and for your teachment. That's the day I be saying. Tonight I'm able to stand here because of my personal faith. In all thy ways acknowledge him, and he will direct your paths. The fervent prayers of many, and support my late husband, Dr. Anthony Regis, my sons who are here in this row, my siblings, my very, very good friends. Tonight, Dame Marguerite, history records that one whose roots are from Fresh Creek, Andros, and Cunningham Lane, Nassau, is recognized for her hard work in public health, and in particular for the promotion of a strategy that prevented children to be born free from the effects of the rubella virus. To PAHO and the committee who selected me, I say a heartfelt thank you and leave you with the words of Archbishop Desmond Tutu. I am because we are. Good night.
Thank you, Dr. Dahl-Regis, for your wonderful and eloquent words and for being the recipient of the PAHO Public Health Hero of the Americas Award. Please join me in another round of applause for Dr. Dahl-Regis. I would like now to invite Dr. Esther de Gouville, PAHO representative for the Bahamas and the Turks and Caicos Islands, to give a vote of thanks for today's ceremony. Dr. de Gouville.
Her Excellency Dame Margaret Pindling, Honorable Minister of Health, Dr. Dwayne Sands, honored guests and colleagues, on behalf of Dr. Carissa Etienne, Director of the Pan American Health Organization, and all of her staff, I would like to convey our heartfelt thanks to those who have contributed to this event. I thank Her Excellency, the Governor General of the Commonwealth of the Bahamas, for spending this time with us and for having graciously allowed PAHO the use of this beautiful venue for this special occasion. Her Excellency's presence reflects the high esteem in which Dr. Dahl-Regis is held and an appreciation for the honor that the award brings to the people of the Bahamas. To the Honorable Prime Minister, Dr. Hubert Minnis, in absentia, I would like to thank him for his kind reflections on the significant contribution of our public health hero of the Americas, Dr. Dahl-Regis, for her national public health contributions and her impact on the international stage. We are grateful for the remarks brought by the Honorable Dr. Dwayne Sands and for his obvious respect, admiration, and appreciation for our awardee and for his continued collaboration with PAHO. To Reverend Drexel Gomez, thank you for the blessing of this gathering and for the word of God and for the reminder of the Almighty's powerful force in our lives. To the Royal Bahamas Defense Force Band that greeted us on arrival, to Mr. Dylan Stewart, Mr. Dexter Fernanda, Mrs. Candice Bostwick, and Dr. Sparkman Ferguson, thank you for the beautiful musical tributes that you shared. My sincere gratitude and appreciation to the many persons who played important roles in the planning and execution of this event. PAHO's Chief of Staff, Dr. Merle Lewis, PAHO's communication personnel from regional and country offices, Permanent Secretary in the Ministry of Health, Mrs. Rena Glinton, and retired Permanent Secretary, former Permanent Secretary, Miss Elma Garraway, for assistance with the logistical arrangements for this evening. All of the staff of the PAHO Country Office, especially Mr. Sherlyn Brown, Ms. Cleola Mackey, and Mr. Gary Cooper for significant administrative support. I thank the Bahamas Information Service for media support, and I want to extend a special thanks to Lieutenant Byron Brown and Chef Jared Forbes of Government House, who assisted in the arrangements for our ceremony in this wonderful venue. I would be remiss if I did not mention Mr. Paul Delacroix Voibois, who has been an excellent master of ceremony. Honored guests and colleagues, the Public Health Heroes Award for the Americas is an expression of the Pan American Organization's deep appreciation for today's awardee, Dr. Merceline Dahl-Regis. In closing, I thank Dr. Dahl-Regis for her passionate and outstanding service to humanity. I wish her God's continued blessings and guidance in all of her endeavors. In the words of Voltaire, appreciation is a wonderful thing. It makes all that is excellent in others belong to all of us as well. This brings to a close the formal part of the evening, and I look forward to interacting informally with our awardee and with all our honored guests as the evening proceeds. Thank you very much.